Okay, like I said, thank you for joining us for the 2020 Benefit Open Enrollment meeting. We are going to cover a variety of different things, talk about some of the changes that are in place for health insurance, give you first an overview of the on-site health and wellness center, and then just some reminders on dental, vision, life insurance, and then the flexible spending accounts. Obviously, new this year is employee self-service. We'll talk about the next steps, and then if you have questions, some resources that are available to you. So part of our HR team that is assisting with open enrollment, you have myself, an employee benefits administrator, and then we also have Becky Freisleben and Maddie Knight, who are also on the WebEx as well. So if you have questions about benefits, certainly you can reach out to any one of us. For the webinar, you just have the three of us. We don't have Claire Shekel or one of the providers from the clinic with us. So to recap for the 2020 open enrollment, so it started yesterday and it runs through the end of October, and all of the changes that you make during your open enrollment election will take place for January 1 of 2020. So now is your chance to make any changes that you want as far as who's covered under your plan. If you don't make a change now, you will have to wait until you experience some type of qualifying event during the year. So that could be, getting married, getting divorced, having a child, things like that. So if you have questions in the future about what could be a qualifying event, you can always reach out to one of us as well. Everybody who is regular full-time and regular part-time should have received an open enrollment guidebook to their houses last week. If you did not, we do have them posted on the intranet, and it's actually a great time because when you log into employee self-service to do your open enrollment, one of the first steps is to update your address. So perhaps we have an old address on file. So this is another active enrollment process for 2020 like it was last year. So you do need to do something. If you don't go in and enroll in benefits, they will terminate on December 31st, 2019. And then we do have instructions in the open enrollment guidebook at the very end, starting on page 31, on how to complete open enrollment. We also have on the open enrollment web pages, intranet and internet, the recorded webinar, and we also have some instructions to walk you through that process. All right, so here you have a listing of all of the benefits that are impacted, and we'll go through each of these in greater detail. But starting off, we wanted to give you a recap on the Employee Health and Wellness Center that's located just down the road at the courthouse. A couple of ways to schedule an appointment. You can call the clinic direct, or you can call the scheduling line. If you have the patient portal enabled, you can also schedule appointments through the portal if that's what you desire. So the clinic access is available for any Waukesha County employee and their family members that are enrolled in the county health insurance, and they will see anybody ages 2 and up for services. So the age 2 is for any acute incidents. So if you have a 2-year-old that you might think has an ear infection, the providers could see them, but they don't start doing annual physicals for children until age 6. So, but again, acute care starts at ages 2. And then again, if you ever have a work injury, anybody can see the provider at the clinic. You don't have to be on the health insurance for a work injury. The Health and Wellness Center is offered in partnership with the City of Waukesha and the School District of Waukesha, and it is open 6 days a week. Mondays and Wednesdays, they are open 7 a.m. to 7 p.m., Tuesday, Thursday, and Friday, 7 a.m. to 6 p.m., and then on Saturdays, the hours are 8 a.m. to 1 p.m. The Health and Wellness Center can provide a variety of different services. So if you would like your annual exams, your preventive exams, your well-man, well-woman, well-child exams, those can be done at the Health and Wellness Center. If you have a chronic condition, they can assist with disease management. So if you have diabetes, if you have high blood pressure, if you have high cholesterol, they can assist you whether you're working directly with the provider regarding prescriptions and your maintenance medications, or perhaps you need some health coaching. You can work with one of the health coaches to talk about diet, nutrition, and receive some ongoing support to help with the management of that disease. You can utilize the clinic for non-preventive care, so acute care. Perhaps you're sick, you think you have a sinus infection, strep throat, your back hurts, you need a mole removed. Those are all things that can be done inside of the clinic. and I had mentioned health coaching, and we do have another slide that talks more on the health coaches. Medications are available in the clinic. There's a limited supply of prepackaged medications, so it's not a full-fledged pharmacy, but if it's something we carry, that prescription is $2 a package, and the clinic is one of your 2 ways to receive a medication in a 90-day supply if it comes in 90 days. The other avenue would be through mail order pharmacy. And then we also offer physical therapy. We just sent an announcement out regarding our new full-time physical therapist, Jen LaPlante, and there's some new PT hours that we'll show you here in just a minute. Labs can be done at the clinic, so if you're doing your annual exam, you can have your annual preventive lab work done, or if you also need some type of diagnostic lab work done, you can have your doctor send those orders to the health center, and the health center can do that for you. You would not be charged for the lab fees. You would only pay your applicable office visit copay. And then if you need referrals to specialists, like you need to see an orthopedist, a neurologist, endocrinologist, they can make those referrals to you as well. And then there is a limited supply of immunizations and vaccinations available, including the flu shot, which just came in. And so we'll be sending out communications to employees about that can be scheduled now at the clinic. And then, of course, I had mentioned work injuries as well. So health center costs for 2020 are not changing if you are enrolled in the Choice Plus plan. Anytime you use the clinic for a visit, it's free. If you're in the high deductible health plan, your preventive visits are free as well. But please note, preventive visits in the community are free also. That's part of our health insurance plan. For the non-preventive and the physical therapy, there's an office visit charge of $30 or $25, and that is because the IRS regulations require high deductible health plans. Members have to pay some type of fee. They can't get it for free. So non-preventive, $30. If you are at your deductible, and so now you're moved into your co-insurance portion where you pay for 20%, you would pay 20% of the $30, so that would be $6 for non-preventive. And then for PT, if you were at the co-insurance amount, it would be $5. And then once you hit your out-of-pocket maximum for the year, those visits would be free as well. For everybody, medications, the ones that are dispensed at the clinic, are $2 a package. If you qualify, some of the ACA preventive medications are no cost to you as well. So I had just mentioned Jen LaPlante is the new PT, and here you have the new PT schedule. So they did change slightly from what they were before. So hopefully if you need PT services, you'll utilize the Health and Wellness Center for that. And PT services are available to anybody ages 12 and up. Some information for Clinic Year 5. This is looking at January through June of 2019. Just looking at the office visits, and you have it broken out by the high deductible health plan and Choice Plus. So for high deductible, there were 779 non-preventive visits in the first 6 months, and Choice Plus had 338 non-preventive visits in the first 6 months. And then you have what the average costs in the community are, and then what those would have potentially cost employees or members out in the community. And then you have the savings and what people have saved by utilizing the health center instead of going into the community. And the next slide shows you the number of medications. There were just over 3,400 containers dispensed in the Health and Wellness Center in the first 6 months of this year. And then looking at what the cost is, using some averaging, that was $59,000 or just under $60,000, but employees were able to save just over $53,000 by utilizing the Health and Wellness Center. Okay, that will lead us into changes for the health insurance plan. So just a reminder, all new hires after 1/1 of 2017 are limited to enrollment in the high deductible health plan, but employees that were hired prior to that and employees who are non-represented can enroll in the Choice Plus plan. For the high deductible health plan, the premiums are increasing 5%. We are implementing the premium designated Tier 1 provider program, And if you do not see a provider who is designated as Tier 1 or has the premium designation, which is in place currently, the coinsurance will change from 80/20 to 70/30%, and we'll go into that in a little bit more detail shortly. For those that do not complete the health risk assessment for the incentive, the opportunity to complete that incentive for 2020 for current employees happened earlier this spring. If you didn't do it, the county contribution is decreasing to $300. Currently this year it is $500. And that $300 will apply to both people who have family coverage or single coverage. We are adding a couple new programs. Real Appeal started yesterday, and we sent out some communication, but we'll go over that in a little bit more detail. And then we are also going to offer the Cancer Support Program, which will start January 1st, 2020. And another change is that your premiums will now be taken out of 24 pay periods or the first 2 checks of the month. Currently this year it comes out of every paycheck, and this is a 27 pay period year, so it comes out of 27 pay periods. So next year, starting with January, it'll go to 24 pay periods. Here you have the premium cost sharing. So like I said, the premiums increased 5%, and for high deductible health plan employees, the premium cost sharing is 15%, and it's regardless of HRA completion. The incentive for the HRA is tied to the county contribution. So the bottom row you have for the single plan, the per pay period deduction amount will be $43.63, and for family it will be $117.89. The health savings account, everybody who enrolls in the high deductible health plan should also have an HSA that is opened. Even if you don't contribute any money on your own into the HSA, you will still receive the county contribution into the HSA unless you notify us, or if we also are aware that you are not eligible to contribute to an HSA. So for example, if you are double covered, perhaps you have coverage through a spouse and that other coverage is a non-high deductible health plan, you are technically not eligible to contribute to an HSA. If you are enrolled in TRICARE, if you are Medicare eligible, you are technically, again, not eligible to contribute to an HSA. So I would encourage everybody to review that information that is in the Open Enrollment Guidebook. This is on page 9 of the guidebook. We also have on the internet and intranet, we have the HSA user guide that will go into more detail. And then within the self-service, there's also an HSA eligibility questions. If you click on that, it's just another tool to educate you to determine if you are eligible to contribute or not. So the county holds the HSA accounts with Optum Bank. So the money that the county contributes and the money that you can contribute pre-tax through payroll is sent only to Optum Bank. If you have a different HSA, you can contribute to that, but again, the county will only direct the funds that we take or provide to Optum Bank. And you can change your HSA contribution at any time during the year. At open enrollment, it'll ask you for an HSA contribution, and that would be what you would like to start out the year with. So if you change your mind sometime in February, March, whatever it is, you can log back into self-service and change the amount. So for 2020, the contributions are going up slightly. The single amount will be $3,550, family is $7,100, and then if you turn age 55, in the course of the year, you can contribute an additional $1,000. And please remember, when you're looking at the annual maximums, it takes into account what the county gives to you in your account, so you can contribute the difference. And on page 8 in the Open Enrollment Guidebook, we give you a chart that shows you what employees can contribute based on what their HRA status is. So the HSA, again, we would always suggest that somebody also contribute some funds, even if it's $10 a paycheck, in addition to what the county provides to you, because you can use this to pay for your office visit fees, your medications, again, things that count towards your deductible and out-of-pocket maximums. And this is money, if you do it through payroll, is taken pre-tax, so pre-FICA, pre-federal, pre-state tax. So you get the triple tax savings. And then once you need those funds, you can access them. And those funds roll over from year to year. You don't lose them the way that you would a healthcare FSA. So here we've got the chart that shows you again, if you didn't do the HRA, the contribution is $300 from the county. If you have family coverage, and this only applies to adults, so the employee and a spouse, the HRA never applies to any children ever, regardless if they're 25. It's only an employee and the spouse. If one of you does it under family, you'd get $1,500. And then if you have family coverage and you both do it, you'd get the full $2,250. And then when it comes to single coverage, there's only one person that can obviously do the HRA, so the full incentive is $1,125. And I just wanted to remind everybody, I'm not going to play the little video for you, but Optum Bank does have a mobile app where you can manage your HSA funds. Just a reminder too, it's always good to keep track and keep your receipts for the things that you're spending your HSA funds on in case you should ever get audited from the IRS. So Optum Bank has a mobile app where you can take a picture and it would store the receipts to the account. And again, just remember, you can access your Optum Bank through myuhc.com, but you can also create an account directly with Optum Bank and access your funds. Because if you do ever separate county employment, that HSA money is yours, and so that Optum Bank account login information would stay with you forever until you ultimately close the account. Whereas access through myuhc.com, if you don't continue coverage of some sort, it would only last you up to 18 months. All right, switching to the Choice Plus plan. So the monthly premiums for Choice Plus are also going up 5%. It's also going to be participating in the premium designated tier provider program, but this plan will also experience some deductible and out-of-pocket maximum increases. The cost sharing for 2020 for Choice Plus, cost sharing for this plan is tied to completion of the HRA. So if you have a single coverage and you complete it, you pay 20%. If you have single coverage and you do not complete the HRA, you pay 25%. So you can see what the per pay period deductions are for completing it and not completing it. And then family coverage, we have the incentive there for 2 HRAs completed, if there's 1 HRA, and then if nobody completes the HRA. And again, that bottom row will show you what the new 2020 per pay period deduction amount is. So what is the premium designated / tier 1 provider program? This is a way that United Healthcare evaluates physicians in a variety of different specialties, looking at evidence-based medicine and some national standards to evaluate cost and quality of providers. So currently, in United Healthcare, these are the specialties that have been evaluated. There's quite a bit of them. And the system that is in place right now, if you were to log into myuhc.com, you would see two blue hearts. And I have to show you both methods because right now, if you're being proactive and logging into the system to see if your doctor is a premium designated / tier 1 provider, you're going to see 2 blue hearts or a gray heart or 1 blue heart, or it's going to be white. But as of 1/1 of 2020, they're changing how they label their providers. Instead of being a premium designated provider, it's going to be a tier 1 provider. And you would be looking for this particular symbol here that says tier 1. So what this means, as of January 1, 2020, if you see a doctor who has been labeled as a tier 1 provider and they are in one of these specialties, your coinsurance, if you're at the coinsurance threshold, will be 20% of the cost. If you choose to see a provider that's in one of these specialties, but they are not rated as a tier 1 provider, your coinsurance would be 30% instead of the 20%. Now, if you see a provider who is in a specialty that is not on this list, because this particular specialty has not been evaluated, you are not penalized. You will remain at the 20% coinsurance. So, for example, dermatology is not on the list here. That specialty hasn't been rated. So you would remain at the 20%. But I would always suggest going on to myuhc.com, or if you download currently their Health for Me app or the United Healthcare app, you'll be able to look up a provider and see where they fall. And right now, like I said, we're using the Hearts program. So if you see 2 white hearts, like on the bottom right there, if they're not evaluated for premium care, again, you're not penalized for that. And again, this only applies once you've met the deductible and you're in that co-insurance threshold. And again, here, some directions on how to find the provider, look them up, and to see if they are a Tier 1/premium provider. Okay, moving on to Real Appeal. Real Appeal is a brand new program that launched yesterday for anybody that is on our health insurance who is over the age of 18. And it is a weight loss program. It is completely digital, so everything is online. And so you enroll online at enroll.realappeal.com. You will need your member ID card. It's going to ask you for your member ID number, your group number, and then you'll fill in some other information, and then you can get signed up. Through the program, you would sign up for weekly group coaching sessions. You will get access to online trackers and tools, so you can track your food intake, your fitness. Once you have your first appointment with a counselor, you will receive the Success Kit in the mail, and it has recipes, there's a food scale, a plate, workout DVDs, there's a bathroom floor scale, and then some exercise bands. Once you complete your 8th visit or 8th appointment, you would also receive one of the blenders, and the blender can be used, and you'll get information in the recipe book for meal replacement. So this program is available, like I said, online 24/7. It's a nice tool. Obviously, we have got a lot of people who work 24/7 positions. It sometimes can be hard to come into the clinic to do some health coaching. This is another resource for employees, spouses, and any dependent children over the age of 18. And this is a year-long program as well. And then we are also adding the cancer support program. Sadly, we tend to see a lot of cancer in our membership population, which is why we are adding this as a program to provide support for employees and their family members who are going through this. This program will allow for you to, if you have cancer, if your loved one has cancer, they can work directly with an oncology nurse and get some guidance. So if you ever had questions about where to kind of go for treatment, or perhaps maybe you met with the doctor but you're still kind of confused, or you have some medications, you're not sure if they would interact with something else, or you just forgot to ask the doctor something, you can't get a hold of them, this is a support line that you could call and work with a nurse, and they would be working with you through the duration of your treatment. And then sometimes too, if perhaps a prognosis is not good and you need assistance with maybe some end-of-life planning, they can also point you in the direction and give you some additional support. And this is something, just remember, sometimes United Healthcare does do outreach. So we have chronic disease management outreach in place too. So they might reach out to you and offer you this program if they see that you or a loved one do have cancer. Otherwise, you can always proactively call them to sign yourself up for this program. But if they do call you, you always have the option to opt out. It's not required. Oops, sorry. Then I wanted to talk about some resources. So United Healthcare has a new app, and it's the United Healthcare app in addition to the Health for Me app. We've been told that eventually at some point in 2020, Health for Me will go away, and then the only app that will be supported is the United Healthcare app. So like again, you can look up doctors, you have access to your ID card on the go. If you need to find an ER, an urgent care clinic, whatever it is, you can look it up through the phone. And then also through the United Healthcare app, you can also do something called virtual visits if that's something that you're interested in. And then again, just a reminder, we have pretty good utilization on myuhc.com. This just shows you what the screen looks like. If you've never signed up, again, it's myuhc.com. If you go to welcome to myuhc.com, you can participate in an interactive demo that will walk you through the website. Okay, so those are our health insurance changes. Moving on to the dental insurance. Overall, there are no plan design changes for either the standard plan or the exclusive plan. The exclusive plan will see a 7% premium increase. However, the Delta standard plan will not have a premium increase. And here you have a breakdown per pay period on the cost. And just a reminder, dental is going to 24 pay periods next year. Right now it comes out of the second check of the month. So the deductions do look a little bit different. So these are the 2020 rates. And just a reminder too, the county pays 90% of the lowest cost plan, which is the Delta standard plan. So that same amount is then applied towards Delta exclusive, and then employees would pay the difference. Reminders on the Delta exclusive plan. This is a plan where you only have coverage within the PPO network, so you do need to see a dentist who is part of their PPO network. We made this switch to Delta exclusive at the beginning of this year. Prior to 2019, we were with Anthem, and we had Dentacare, and you had to designate a center for you and your entire family. That is no longer the case. Anybody in your family can go anywhere under Delta exclusive, as long as you're each seeing a PPO network dentist. If you see someone who's not in the PPO network, you will not have coverage for the services that you receive. Just a reminder, there's no annual maximum like there is for the Delta standard plan. There is no deductible, and through this plan there is a richer orthodontia benefit. You pay the first $650, and then 100% of the treatment is covered by the plan. In comparison, the Delta standard plan has a wider network. You can see any doctor, provided that they accept the Delta dental insurance. So you could see someone in the Premier network or the PPO network. This benefit is limited to $1,250 per year. So once you do have services that are above $1,250, you would be responsible for that cost. There's also a $25 per person deductible, up to $75 per family, but just know any preventive care, so your annual cleanings, things like that, those you do not pay a deductible for that. The deductible applies to when you're having additional work or restorations or some of the ancillary work. The orthodontia benefit for under the Delta Dental Standard Plan isn't as rich as the exclusive plan. So you will receive up to a lifetime maximum benefit of $1,500. Whereas in the other plan, you pay for the first $650, and then it's covered by the plan. And again, orthodontia under the standard plan is limited to dependent children under the age of 19. And under the exclusive plan, there are no age limits, and there's no lifetime maximum. So when I say age limits, if you and your spouse obviously are, if you're adults and you want to have orthodontia done, you could also do that through this benefit. And Delta Dental also has a website and an app available. You can look at your explanation of benefits, you can check on your claim status, you can print ID cards, and then what's nice is that it gives you a breakdown per enrolled member, when they last had, maybe when did you last have bite wing x-rays, when did you have a teeth cleaning appointment. It will give you the date and then where you're at as far as your deductible and perhaps your maximum annual benefit amount for the year as well. So we also have vision insurance through Superior Vision. For 2020, there are no insurance plan design changes, and the premiums that we have in place will be in place through the end of 2022. And here you have what the monthly contribution amounts will be as well. For the exams under this plan, there is no copay. And as far as the frequency for services, you can get one exam per 12 months, and it is 12 months from the last date of service. Frames are covered once every 24 months. Lenses for those frames are covered once every 12 months, and contact lenses are covered once every 12 months as well. And here you have what the breakdown is for the amount of coverage. In network, you receive a greater benefit versus if you see a provider that is out of network. So like I said, the exam is covered in full. For frames, you get up to a $150 allowance. And then depending on the type of lenses you get, they could be covered in full. And then if you start adding on some additional things like scratch resistance, or you want super thin lenses, you will pay for the overage above what the standard benefit is for the lenses. Contact lenses, you receive up to $175 per year for that. And please remember too, with contact lenses, your provider usually charges a contact lens fitting fee. You could choose to have that contact lens fitting fee charge come out of your $175 and then use what's remaining to pay for your prescription lenses, your contact lenses, or you can pay out of pocket for the contact lens fitting fee and then use that full $175 for the contact lenses. And then there is a small LASIK benefit as well, $200 per lifetime if you choose to have LASIK done. And again, if you have never used superiorvision.com, they too have an online portal where you can log in and you can see the different services, the descriptions, what the frequency is for the benefit, if there's a copay, and the amount allowed per that pay period, and then when your next available date is for that particular category. And they also have a mobile phone app. If you wanted to do that, you could also get access to your ID card through here. All right, then moving on to our supplemental term life insurance with Voya. Last year at open enrollment, we offered this as a brand new benefit to start 1/1 of 2019. And if you previously enrolled when you were first eligible, so whether it was at open enrollment or as a new hire, you can now increase your amount of coverage by one level without medical underwriting. So for example, if you enrolled in $25,000 worth of coverage previously, you could increase to $50,000 at this time without needing to go through medical underwriting. If you are a late enrollment and you didn't sign up last year when you were first eligible at open enrollment, or perhaps as a new hire, you can still sign up now, but you are a late enrollment and you would be subject to medical underwriting first before coverage would take effect. And on page 25 in the guidebook, we have the age bands along with the cost, and they're offered in $25,000 increments as well. Our flexible spending accounts, we have two accounts offered through Employee Benefits Corporation. First is the Healthcare FSA, and this is a way for you to put aside pre-tax dollars to pay for out-of-pocket expenses, prescriptions, anything that might be a qualified expense through the IRS. And you can enroll in this if you enroll in the Choice Plus plan or you have other PPO type coverage, maybe through a spouse, but you cannot be enrolled in a high deductible health plan and also enroll in the Healthcare FSA. So just remember, for people in the high deductible health plan, you have the HSA that you can contribute pre-tax dollars to. If you're in the Choice Plus plan, this is your way to get that pre-tax savings. So every year you have to re-enroll in this. So if you are enrolled right now for 2019, you do have to re-enroll for 2020. And for next year, the maximum annual election for Healthcare FSA is $2,700, and the minimum annual election is $10 a pay period, so $260. This is something that will come out of every pay period. On the other side, we have the dependent care FSA, and this is money that you can put aside pre-tax to help pay for child or elder care expenses. And again, you have to re-enroll every year. The maximum annual election is $5,000, and the minimum is $260, and it comes out every pay period. Just remember, with the FSAs, the money does not roll over from year to year. It is use or lose, so you do need to make sure that you submit your claims before the run-out period expires in order to get that reimbursement. And EBC also has a mobile app, and you can see what your balance is. You can submit claims through the app. You can also submit claims online. So basically every carrier has some type of website, portal, or app available to you to get access to your information. So the next steps, just a reminder, everyone's got to do something by October 31st, and you would be logging in through self-service, self-service.walk.waukesha-county.gov. It's accessible anywhere where you have internet access. You do not have to be on the county network in order for it to work. And I wanted to say that I understand that we're currently having issues with the system, and I wanted to thank everybody for their patience as we kind of work through this process. We hope to have that resolved fairly soon, and the issue outstanding in the system currently is there is not a decline option for the HSA. So we are working on that. If you have the HSA and you're going to contribute money from the employee portion, you have no issue submitting a form, but it's for those who might enroll in Choice Plus or those who don't want to contribute to the HSA. So we do have an internet site, waukesha-county.gov/open enrollment, where we have open enrollment materials. So if you're at home, otherwise we always have more resources on the intranet under employee benefits through the specific benefits. So if you clicked on health insurance, dental, and then if you wanted to access the guidebooks, we have an open enrollment link, and that will take you to that information. And that is it. And I'm going to unmute the group and see if anybody has any questions. Okay, I am not seeing any messages as far as people typing on the conversation. I'm not hearing anybody say anything. So again, if you do have questions, you can certainly call us in HR. Just a reminder too, we're going to have open enrollment workshops starting next week. So if you do need assistance submitting your open enrollment election form, you can stop in the guidebook. We did have the dates for those workshops. So just pop into 155 anytime during those time frames, and we'll be there to assist you. Oh, I see a message is coming. Yes, I am recording it now. I will post it to the intranet and internet for you. All right, seeing there are no other questions, I just want to thank you all for joining us, and that is it. So have a great day.